And once again, I want to say greetings to each and every one of you, Aquaba, and welcome. Welcome to another round of Tech and Future Talk here on LIB Radio, LIB TV, here on livinginblack.com. My name is Keedy Owado, aka The Conscious Rasta. Weekday mornings, you and I get together live. We come at you from 9 a.m. Pacific time. That's 12 noon Eastern time, 5 p.m. GMT, and 8 p.m. East Africa time. We get together with you and we deal with culture, consciousness, historical perspectives, entertainment, economics, education, health, labor, law, politics, religion, family, conflict, future studies, all areas of human interactivity and development. Today's date is Thursday, the 3rd of July, the year 2025 in the Western calendar. This corresponds to the year 6265 in the Kemetic calendar, to which we have realigned our cultural clock. Welcome to the 7th millennium. You have found your family in a peaceful place here on LIB Radio, LIB TV, on Living in Black. Today, Tech and Future Talk, Medical Nutrition Therapy, MNT, Medical Nutrition Therapy, is a specialized approach to healthcare that focuses on the role of nutrition in preventing and managing diseases. It involves personalized dietary plans developed by registered dietitians to address specific health conditions and promote overall well-being. Medical nutrition therapy considers individual needs, medical history, and lifestyle factors to create effective nutrition-based strategies. This therapy is crucial for managing chronic illnesses such as diabetes, heart disease, and obesity, as it helps in controlling symptoms or reversing symptoms and improving quality of life. By emphasizing balanced eating habits and nutritional education, medical nutrition therapy empowers patients to make informed choices that support their health goals. So that is the broad topic we're talking about today. Now, let's be clear, medical nutrition therapy is generally applied to registered dietitians and nutrition therapists. Let's be clear, I am not a registered dietitian or clinician. Although I very much doubt if any of the registered dietitians and nutritionists have done more studies than I have done. And today we're going to acknowledge registered dietitians and clinical nutritionists, but I can tell you one big difference between them and myself and people like myself, Dr. Sebi, Layla Africa, and so many others. The difference is that they manage these diseases. Diabetes is going to come up quite a bit in this medical nutrition therapy. Management of diabetes, and I'm going to put Dr. Gabriel Cousens on our team too, because he put out a book. There is a cure for diabetes. There is a cure. The cure is here. It's available to almost everyone. Almost everyone. Dr. Gabriel Cousens put out this cure. It is available to you and to you and you and you. Look under your seat. You is prize for everyone. Yet, as you and I very well know, the majority of people will not choose to go with this solution. And that's tragic, but it is what it is. First of all, I'm going to share with you a piece of video. Let me just get this off my desktop. I'm going to share with you a little piece of video on this topic here today. And this short piece of video is going to just loop, and it's going to show you areas where medical nutrition therapy can be effective. Now, I'm going to enlarge this. Well, I'm just going to go ahead and let it loop while I am talking. Again, it doesn't have an audio track on it. Let me just figure out where it is. There it is. And here is what we're looking for: an anti-inflammatory grocery list. Let's go ahead and play this video. And it talks about the areas where medical nutrition therapy focuses. And this is pretty much good. I do have a little bit of contention with the second category. The first category, fruits and vegetables, lists a bunch of very healthy fruits and vegetables. By no means is the list limited to that. Talks about fruits and veggies. Under the third category, nuts and whole grains, I definitely do agree with that. The fourth category talks about seeds, drinks, and more. That is an excellent list. Coffee is a little questionable. And he said, these are things missing here. Pasteurized, raised eggs. No, I do not agree. Grass-fed, grass-finished, and red meat. No, those do not belong on that list of an anti-inflammatory food. That's absurd that someone will put these things on here. But no, red meat is inflammatory. There's no debate on that. We can go to study from University of San Diego, December 2014, which talks about NEU 5GC, a sugar-like molecule that is always present in grass-fed beef and all of those things, always present, for which humans cannot process that, and it is highly inflammatory, raises inflammation up by 5 points. So also it says protein and healthy fats, because they have salmon, sardines. I do not, but you can if you choose to. Chickpeas, seitan, tofu, lentils, love it. Herring, I don't mess around. Chicken, white meat, turkey, white meat, shrimp, Greek yogurt, cottage cheese. I do not eat any of those. I do not recommend those to my clinical nutrition clients, especially when fighting against acute inflammatory diseases. So that's enough of that. That was a little painful, but that's okay. We're stretching the boundaries of what we think about and what we do talk about here on LIV Radio. Now, I'm going to go into my assembled group of research today: diseases that are addressed by medical, clinical, medical nutrition therapy. Clinical nutrition addresses a wide range of diseases and conditions, particularly those related to nutritional and metabolic changes. It focuses on the prevention, diagnosis, and management of nutritional issues in patients with chronic diseases and conditions. Clinical nutrition is used to manage diseases such as, now they use the word manage, I want to point that out, to manage diseases such as people with type 2 diabetes, high cholesterol, and other metabolic disorders. It also plays a role in management of conditions like cancer, cardiovascular disease, neurological health issues, obesity, high blood pressure, hypertension, and chronic inflammation. Additionally, clinical nutrition is involved in the management of diseases caused by a lack or excess of energy and nutrients. The field also includes the role of medical nutrition therapy to treat and manage various heart conditions. Medical nutrition therapy plays a vital role in comprehensive patient care and disease management. I'm going to keep going. Medical nutrition therapy is a nutrition based treatment. It focuses on assessing the individual's nutritional status and providing an individualized nutrition plan for their health condition. It is a form of treatment that uses nutrition education and behavioral counseling to prevent or manage a medical condition. Medical nutrition therapy is usually recommended by a healthcare professional and thoroughly assessed by a registered dietitian, nutritionist, RDN, who works closely with the individual and medical team to establish an individualized nutrition plan. Now, I can there's no doubt that I would disagree with any part of that. The key about it is this is not medical nutrition therapy is not necessarily changing the paradigm. It's not shifting the paradigm. So what they say about this is all well and good. But at the same time, drugs for managing medical conditions, not curing, not preventing, but drugs for managing them, what's called health, it's called sickness care maintenance, colloquially I call that. Though that is the dominant therapy for which you and I have the right, maybe we have the responsibility to disagree with this system. Now, I want to say greetings. I do see you in the house, my sister 4, Africa 1. It is always a pleasure to greet you. She sends her greetings, Hatep, Brother Kiti, and Global LIB family. Let's go. Let's continue to deal with this topic of medical nutrition therapy, a new approach to health and healing. So let's get this party started. Where we at? We got through medical nutrition therapy is used in a wide variety of medical conditions. For example, individuals with diabetes mellitus or diabetes mellitus can benefit from medical nutrition therapy to improve their glucose control and prevent long-term complications. Likewise, medical nutrition therapy can help lose weight and improve nutritional status in individuals with obesity or cardiovascular risk factors, such as high cholesterol or hypertension. It may also be used in individuals with gastrointestinal disorders, such as gastroesophageal reflux diseases, GERD, celiac disease, inflammatory bowel disease, irritable bowel syndrome, and short bowel syndrome, as in those with liver or kidney disease. Now, all of these conditions, I do agree that medical nutritional therapy is helpful. But the problem is, people, where is the medical industry going with this? They're not going anywhere with this. Where would you like to go with it? I say you and I should take it as far as it could go, within which I will discipline myself to the utmost. Medical nutrition therapy is a flexible form of individually tailored therapy that achieves nutrition-related goals by utilizing a coordinated team. Hey, put me in the game, coach. We got to have a win here. But unfortunately, the coach I'm speaking to is not your medical practitioner, is not your cardiologist, it's not your endocrinologist. It's not your rheumatologist. It is not your gastroenterologist. The team I'm looking to be put on is going to have to be coached by you. You're going to have to be the coach. You're going to have to be the one to engage me. We can do a whole lot better than what we have been doing. It is an evidence-based process aimed to treat or manage a disease through nutrition. Its components are comprehensive and includes assessment of nutritional status and provision of nutritional diagnosis, diet modifications, counseling, and specialized nutrition therapies provided by a registered diet nutritionist, RDN, registered diet nutrition, or a nutrition professional. Well, I am not a registered dietitian. I look forward to becoming a registered dietitian one day, but I have to take the time and go to school and get the certification. I am a nutritionist professional. Continuing, medical nutrition therapy is a Medicare Part B benefit. Under Medicare Part B, nutrition therapist billing codes are only authorized for use by a registered dietitian or qualified nutritional professional. Medicare covers medical nutrition therapy services if you get a referral from your primary care provider and have one of the following conditions. Number one, diabetes or chronic kidney disease, or have had a kidney transplant within the last 36 months. Those are the only two conditions by which Medicare Plan B will allocate the funds to compensate a registered dietitian. Is that happening? I don't know that it is. I see people out here with chronic kidney failure. They're on dialysis. I see so many people are diabetes, pre-diabetes. The solution for diabetes is not real complicated. I sent a note to someone yesterday that it's only like 4 steps maybe for solving the issue of chronic diabetes. Diabetes mellitus is really about an insensitivity to insulin in the pancreas. So therefore, the first rule would be re-establish the pancreas's sensitivity. You can do that in 5 days, 3 days. 5 days would be better. Reestablish the insulin sensitivity, and then once insulin sensitivity is re-established, then you keep it there. You keep it there. And that is, of course, through diet and nutrition. And the third process, I would say, if you are diabetes, the first thing you did, you reset your pancreas sensitivity to insulin, your body's sensitivity to insulin. Then you combat, well, there's actually one more phase. You combat the inflammatory condition which set this up in the first place. Once your pancreas is reset, then you combat the chronic inflammation, which is going to bring it back or did maintain malfunction of your pancreas. And then the next step, I would say, would be regenerative medical therapy. Regenerate your pancreatic beta cells through stem cell rejuvenation. That's it. That's it. Now, you really don't have to think hard about each of these steps, although you do have to do the right inputs to make sure that each step does occur with your body. It's not that difficult, people. We're under the tremendous influence of people who don't necessarily care about us in the long run. They couldn't care about us. Otherwise, they wouldn't be giving us the very poor information that is widespread. We're talking today about medical nutrition therapy. Let's continue. We are medical nutrition therapy is recommended for people with type 1 or type 2 diabetes to achieve optimal treatment goals. And the optimal treatment goal would be to reverse type 1 or type 2 diabetes mellitus. The American Diabetes Association recommends specific goals for medical nutrition therapy for persons with varying types of diabetes geared toward more flexibility and patient-centered. But I really don't see them talking about cure the diabetes. Dr. Gabriel Cousens says it very clearly in the title to his book. There is a cure for diabetes. And let me tell you, I truly admire Dr. Gabriel Cousens. I truly admire Dr. Sebi, Dr. Laila Africa, and so many others who gave us fixes for these diseases and disorders. I would add my name to that list. Medical nutrition therapy is also called nutrition counseling. Your registered dietitian will work with you to create a nutrition plan that meets your dietary needs while giving you feedback. The initial visit lasts at least 30 minutes and includes a review of the patient's current eating habits. If possible, the patient should maintain a written record of all foods eaten for 3 days prior to the visit, including the time eaten and the amount consumed. That's pretty good advice. I do recommend everybody, if you're dealing with what you perceive to be a chronic inflammatory condition or a chronic digestion or nutrition related condition, definitely keep a tight food diary. If you bring that tight food diary to me, I'm going to look at it, I'm going to examine it, and I'm going to say, here are points where you could, would, should make corrections. Medical nutrition therapy is a key component of diabetes education and management. Studies have documented an association between MNT delivered by a registered dietitian and hemoglobin A1C decreases for people with type 1 diabetes, a decrease of 0.3% to -1%, and type 2 diabetes between 0.5% to -2%. Medical nutrition therapy is a covered Medicare Part B benefit for any beneficiary with a diagnosis of diabetes or chronic kidney disease, or who have had a kidney transplant within the past 36 months. Medical nutrition therapy is also used to prevent or treat malnutrition in individuals with chronic illnesses, those hospitalized for an extended period, or have undergone major surgery. It can also be a part of treatment in individuals with metabolic disorders or severe food intolerances who require strict diets. Now, that's an interesting area because now it's finally getting into one of the key areas that, as a functional medicine practitioner, I have a very keen interest in metabolic syndrome disorders. Metabolic syndrome disorders. Let me list them, 10 of them. Overweight obesity, abdominal obesity or visceral fat, high triglyceride levels in the blood, imbalance in your LDL, HDL levels. An imbalance of LDL is too high, HDL is too low. That's so-called high cholesterol is what your doctor calls it. That's not even accurate enough for me. Number 5, chronic nephropathy, which is a slow degrading of your function of your kidneys. Number 6, disruption of your gut microbiome. Number 7, did I get up to number 7? I must have skipped 1 or 2. Number 7, we're going to call this, would be cancer is a metabolic disorder, metabolic syndrome disorder. It would also include non-alcoholic fatty liver disease. That's number 8. And then there were 2 more that I missed. Overweight, obesity, abdominal obesity, triglycerides, cholesterol, chronic kidney. There were 2 more that skipped my mind. Bear with me, but they're in the books. I could grab a book right now and tell you what those other 2 are. Oh, hypertension. Number 9, hypertension, high blood pressure. And number 10, high blood sugar. That's diabetes. So those are the 10 metabolic syndrome diseases. Don't let nobody fool you. Don't let your doctor get away with not knowing what they are. And I can guarantee you this, among my clients, my patients, at least 80%, if not 90%, have never been told by their doctor that they have metabolic syndrome. They've never been told, at least 90%. I'm thinking it might even be closer to 95%. The doctors don't add these up. Metabolic syndrome diagnosis includes 3 or more of the following. So if you present to your doctor, if you are hyperglycemic at 2 months, your A1C is too high, if you've got high blood pressure, and if you are overweight or obese, you have metabolic syndrome. It could also include your cholesterol, your triglycerides. You have metabolic syndrome. Could be that your belly is so big because you have non-alcoholic fatty liver syndrome. That fat is inside the rib cage and is pushing out on the soft tissues and soft muscles. And your doctor never told you this, did he? Never told you. I care about you more than that. I'm going to tell you within a 30-minute call. I'm going to tell you as quickly as possible. You have metabolic syndrome. Now, let's look at the common cause of metabolic syndrome. And yes, it is chronic inflammation. I see in the house Rhonda Cooper. I see you. She says, Uja Abakiti and all. Greetings from sweet Jamaica. No way. You went to Jamaica. You didn't tell me. I ain't mad at you. I'm glad at you. I can just see you smiling from ear to ear right now, beaming and glowing in Jamaica. My beloved sister, welcome, Aquaba. You have found your family in a peaceful place here on LIV Radio, LIV TV, livinginblack.com. We are live and we are continuing. It is Thursday, 9:31 a.m. here on the West Coast. That makes it 12:31 p.m. for our East Coast listeners. And that makes it, what, 5:31 BST. I may have said GMT earlier. I say it without thinking. But BST, British Summer Time. So we continue. We are today talking about medical nutrition therapy. Let's get back on the research that I pulled for today. I've got medical nutrition therapy is also used to prevent or treat individuals with chronic illnesses, those hospitalized for an extended period, including quote unquote long COVID, you know what I'm talking about, or have undergone major surgery. It should be part of treatment in individuals with metabolic disorders or severe food intolerances who require strict diets. Those severe food intolerances, allergies, these food intolerances did the allergies just suddenly appear? Are you just now allergic to peanuts when you weren't when you were a child? Are you just now allergic to other diseases? That is a sign of autoimmune disorder, autoimmune disease, of which there are over 60 autoimmune disease diagnoses and manifestations: asthma, allergies, sarcoidosis, lupus, a whole bunch of them. Alopecia is an autoimmune disorder. So we're going forward. There's a bird out here chirping, sounds like a piece of metal or something, but that's a beautiful thing. We encourage the birds to chirp. So there are a number of articles that now I'm going to pull up, and I'm going to start sharing these articles with you, my listening audience. The first one, I'm going to put up the links, and the link to this one here, push it up on Rumble. I'm going to push it up on Facebook as well. Where Is You Is Medical Nutrition Therapy. I'll push it up here. Also, I need to reboot that page. Oh, yeah. And I'm going to reboot that page and push it up under the live Facebook. And since we have you on Rumble today, not Rumble, on YouTube today, I'm going to push it up on to YouTube. The article is entitled, What is Medical Nutrition Therapy? Written by Christine Lacanti for WebMD. I read the article a little bit earlier. It's not the greatest article, but it's not bad. So I'm going to share this with you, if you don't mind. And let's take it over here. This is the article by Christine Lacanti, WebMD, and this is what it has to share. Where is it? It's over here. Christine Lacanti, what is medical nutrition therapy? Is it here? Here it is. Medical nutrition therapy. Again, what is medical nutrition therapy? Medical nutrition therapy, MTMNT, is a way to manage chronic health conditions. I don't like that word manage. If we can use the word reverse, cure, get rid of, that's a better term. But they're talking about managing it, especially through weight loss or weight maintenance. This therapeutic approach to health can help you reduce symptoms of certain conditions and prevent further health complications by following a personalized diet and meal plan. To get started with medical nutrition therapy, you need the help of a registered dietitian nutritionist, RDN, who should seek medical nutrition therapy. Medical nutrition therapy aims to manage certain chronic conditions through an individualized nutrition plan. Medical nutrition therapy is also called nutritional counseling. Your registered dietary nutritionist will work with you to create a nutrition plan that meets your dietary needs while giving you feedback. While many people may feel nervous or reluctant about starting a new diet, quote, or meal plan, your dietitian will give you the tools you need to manage your chronic condition through dietary changes. Now, think about that paragraph. They said, while many people will feel nervous or reluctant to change their diet to get rid of the condition. Why? Why would you feel reluctant if someone told you, hey, you need to stop eating red meat? Because red meat is causing you chronic inflammation for which you may be suffering celiac disease, Crohn's disease, gastrointestinal disorders. You may be suffering from overweight, obesity, clogged arteries, atherosclerosis. But you are nervous or reluctant to change your diet. Hmm. Your doctor may suggest nutritional therapy if you have one of these conditions: diabetes, heart disease, renal disease, meaning your kidneys are malfunctioning, obesity, gastrointestinal disorders, osteoporosis, cancer, history of a heart attack. But oh, it's much, much more than that. I have this list on here. This list extends to celiac disease, elimination diets, food intolerances, gastroesophageal reflux disease, GERD, inflammatory bowel syndrome, inflammatory bowel disease, motility disorders, eosinophilic esophagitis, esophagitis, eosinophilic esophagitis. Ooh, got it. Eosinophilic esophagitis is a chronic allergic inflammatory disease of the esophagus. It's an autoimmune disorder characterized by the accumulation of eosinophils, a type of white blood cell in the esophagus. That's indicator of an autoimmune disorder. This accumulation leads to damage and inflammation, which can cause symptoms such as difficulty swallowing, food impaction, vomiting, and heartburn. Eosinophilic esophagitis is thought to be an immune system or allergic reaction to foods or environmental allergens, and it can occur at any age, though is more common in white males. This condition was also once considered part of gastroesophageal reflux disease, GERD, but now it is recognized as a distinct entity. Treatment may involve removing known triggers and using medications to suppress the immune response. That's an autoimmune disease, and as a classic response to autoimmune disease, with endoscopic procedures sometimes required in severe cases. So that is what eosinophilic esophagitis is about. But other areas, other diseases include, for medical nutrition therapy, include anemia, easy to treat, cancer, Better that you prevent it than have to cure it. Celiac disease, very easy to deal with. Colitis, Crohn's. Crohn's disease is a type of inflammatory bowel disease that may affect any segment of the gastrointestinal tract, from the mouth to the anus. Symptoms often include abdominal pain, diarrhea, fever, abdominal distension, and weight loss. Complications outside of the gastrointestinal tract may include anemia, skin rashes, arthritis, inflammation of the eye, and fatigue. The exact causes of Crohn's disease are unknown, so they say, but it is believed to be caused by a combination of environmental, immune, and bacterial factors in genetically susceptible individuals. That means it is a inflammatory based disease. That means it's an autoimmune disorder. It results in a chronic inflammatory disorder in which the body's immune system defends the gastrointestinal tract, leading to persistent inflammation. Classic description of an autoimmune condition. Other conditions that are available for medical nutrition therapy include diabetes, diarrhea, diverticulitis, inflammation of your diverticula in the colon, eating disorders, food allergies, gout, heart disease, high cholesterol, hypertension, HIV or AIDS, hypoglycemia, hyperglycemia, irritable bowel syndrome, kidney disease, kidney stones, lactose intolerance, liver disease, malnutrition, neurology or multiple sclerosis or ALS, pancreatitis, Parkinson's, prenatal nutrition, reflux disease or acid reflux or GERD, tube feedings, vegetarian diets, yes, that's medical nutrition therapy, weight management, women's health, and men's health. These are all areas of your concern, my concern. I'm going to go back to the article I was reading from earlier. It is that we're under the topic of who should seek medical nutrition therapy. So if that you had any of those disorders, I just listed a long list of over 30 of them, you should be using medical nutrition therapy. All of us should be using this to prevent all of those diseases. Nutrition and diabetes. MNT is helpful for people with diabetes. Medical nutrition therapy often complements diabetes treatment, as your diet has a large impact on this condition. A personalized plan for nutrition and diabetes can help you maintain your blood glucose levels within a normal range. Medical nutrition therapy can help reduce symptoms of diabetes, such as weight gain and frequent urination. Weight loss. Nutrition therapy is a useful tool for people who want to lose weight. Weight management and nutrition go hand in hand. So MNT can help you to look at the foods you are eating and your eating habits. Your doctor may recommend medical nutrition therapy if you are obese, because losing weight can help prevent further health complications such as high blood pressure, heart disease, diabetes, liver disease, infertility, stroke, certain cancers, mental health problems, chronic kidney disease, and so many others. How does medical nutrition therapy work? To start medical nutrition therapy, you need a referral from your primary care doctor or a referral from a client of mine would be helpful. However necessary. If you are hearing this conversation and you have any of that long list of diseases and disorders that I mentioned earlier, any of them, gout, food allergies, eating disorders, any of them, you could, would, should contact me and let's get together, come up with a plan. And not only that, but let's make the food incredibly delicious. I personally have written 3 vegan, vegetarian, and raw food nutrition diets, 4 actually, with Transforming Soul Food contains only 25 of my favorite vegan soul food restaurants, but it is a wonderful source. But let me tell you, on my bookshelf, I have a whole list of raw vegan recipe books, a whole bunch of them on my bookshelf. And you know something? The food is fantastic. People have been to my house. In fact, on June 12th, I will invite you over once again to our home here in Desert Shores. And we're going to have a raw and cooked vegan feast. It's going to be on and popping. I guarantee you, the food is delicious. It will transform the way you think of the potential of healthy eating, vegan food. So why not? Why not consider trying it? Why would we not? I think we should. Let's continue. How does medical nutrition work? It looks at your current eating habits and lifestyle. That's the first thing we're going to do when you and I do a one-on-one consultation. First thing we are going to do is look at your current eating habits and lifestyle. I will then give you an in-depth assessment of your nutritional status and then work with you to develop a personalized nutrition treatment plan. Your initial appointment with me or a registered dietary nutritionist will take about an hour. During this time, the RDN will ask you about your current diet and lifestyle. Using this information and your medical history, they will ask you what your goals are for medical nutrition therapy. Together, you decide what outcomes you're looking for while creating a personalized plan. Your R&D will most likely ask you to start a food journal so you can reflect on your diet and results and habits. This can help your dietitian decide where you need to change or improve your plan. Your registered dietary nutritionist will keep in mind your cultural preferences and the latest research and science while working on your plan. Follow-up visits, dietitian will provide you with tools to help you through medical nutrition therapy. They will teach you, I will teach you how to make better food choices and track your progress. Your RDN will use your updated lab results and monitor any health changes to make sure your nutritional needs are being met. And the article goes on. It's got a little bit more to it. Let me read it. Let me read just at least this next section. What are the benefits of medical nutrition therapy? And we should be asking that question. Let me put that question up for you in our various chats. What are the benefits? What are the benefits of medical nutrition therapy that you could, would, should expect to be getting out of it? Let's talk about that. What are the benefits of medical nutrition therapy? Let's go into it. Oh, I'm in the article. Here we are. There are lots of benefits of nutrition therapy. In addition to helping you manage your chronic condition, medical nutrition therapy can help prevent future health issues. Since you are getting the help of an RDN, they can customize a dietary plan if you can help that can help you to lower the risk of diseases like heart disease, obesity, and diabetic neuropathy. I would say get rid of the diabetes and therefore get rid of the peripheral neuropathy that's caused by an imbalance in your insulin in your body, an insulin insensitivity. To get rid of the diabetes, get rid of the risk, the very high risk. The risk is 2 out of 5 people for cancer. You can eliminate that risk. Prostate cancer, reproductive cancers, breast cancer. You can pretty much, it's not complete. I can never say complete, but you can pretty much eliminate that risk. The lowest risk of cancer ever recorded was in ancient Egypt, and that was 2 of 400. Now it's 2 out of 5. 40% of the population will develop cancer in their lifetime. In this generation and in the youngest generations, our children, the risk will be 1 of every 2 will develop cancer in their lifetime. That's unacceptable. That's completely unacceptable. Isn't it? Yes, it is. We should consider it to be absolutely, undeniably unacceptable. Going forward, we are live here today. It is Thursday. Thursday is Tech and Future Talk. We're talking about the future of medicine, y'all. The future of medicine has arrived. Medical nutrition therapy. Future of medicine is here. And we are going to deal with it. That's right. So let's go forward. What are the benefits of medical nutrition therapy? There are lots of benefits. Weight loss is often the primary goal. The benefits of weight loss include increased energy levels and healthier habits. You will notice that when you work with your RDN, you immediately begin to increase your physical activity. You will make healthier choices. You will learn to read, scrutinize food labels, and I will tell you something your RDN will never tell you. You need to wholly and completely avoid processed foods. If you can't read it, if you can't pronounce it, it's on the label, it is not food. Your RDN is not going to say that. You think your RDN is going to tell you don't eat pasta? I'm going to tell you that. Don't eat pasta. It's glue. It glues up your insides. It's made from wheat gluten, which is very problematic, especially from the dwarf variety wheat that has been grown and distributed in across North America for 50 years now. That dwarf wheat variety, that's no good. They've increased the gluten and the galastian, what's it called? Is a protein in the wheat. This is very important. Let me get this term for you. And his book is entitled The Perfect Poison. And that is wheat protein. And that perfect poison is, I'm going to give you his name, Is Wheat a Perfect Chronic Poison? From Best Food Facts. And here's what it says. This is good information. Wheat as perfect poison. Dr. William Davis. Please remember his name. Dr. William Davis, a cardiologist, has claimed that modern wheat is a, quote, perfect chronic poison, unquote, primarily due to a protein called ghaladen. He argues that ghaladen binds to opiate receptors in the brain, stimulating appetite and leading to increased caloric consumption, which may contribute to obesity and other health issues. Davis suggests that the wheat we consume today is different from the wheat of previous generations, as it has been genetically modified to increase yield and shelf life, introducing new proteins like gliadin that were not present before. However, experts like Dr. P. Stephen Benziger note that wheat is higher in protein and lower in carbohydrates compared to other grains, and that the claims about gliadin causing widespread health problems are not fully supported by scientific evidence. Additionally, while some studies suggest a link between gliadin and certain neurological effects, the majority of the population does not experience adverse effects from wheat consumption, and it remains a staple food for millions. Well, I can assure you listening, I do not consume wheat products. I don't eat bread. When I say I do not consume wheat products, I'm thinking about it. No, I do consume non genetically modified tortillas. So if it says non GMO on the label on the front of it, those wheat products I do consume. By and large, though, I'll be honest with you, I avoid wheat. I think wheat disrupts my metabolism, and noticeably so. I am right now still on my 28-day detox fast. I think today is about day 10 or 12 or something. I think it's day 14 or 15. And I am not eating any wheat products. And it feels good. My weight is now quite a bit under what I weighed when I was 25 years old. So I do recommend everybody be like me. If you can be like me, be like us. I want to be like you, want to be like me. We want to be like us. So we don't have to deal with the chronic diseases that unfortunately are affecting so many of our brothers and sisters. So we do better than this? Yeah, we can. That's a good article. I'm going to paste that one in today's research because that was a very good article. And I keep coming back to this. So I'm going to paste this up here in a place where I'm going to know it. We're talking about what is medical nutrition therapy by Christine LeConte. That was the article we were just reading. I'm going to paste this one in right here. What wheat as a perfect poison. And real quickly, I'm going to post this up, and let's keep going forward. The next article I want to share with you is medical nutrition therapy for diabetes. This is from ScienceDirect.com. Topics: agricultural and biological sciences, medical nutrition therapy for diabetes. Let me post this link up for those of you who do like to have these links. And I hope you are listening today. If you are in the house, please do give us a shout. We'd love to hear from you because you do matter. I have the greatest love and commitment to all of you who are in my listening audience, and post this one up right here. Don't do that. And I'm going to post it up one more time right here. Post it up, and there we go. Did I post it up everywhere? Did I get it on Nope. I see you in the house, Brother Nguvu. I'm going to answer your question here right now. Let me just put this link up, and this is not going to fit. Oh, it does fit. Okay. Nguvu, I see you in the house. He says, what water is best? Coconut, spring, sun, etc., and how much per day? That's a great question, Nguvu. Thank you for asking that, and I will drink to that. Mm. The best water of all of you listed there would be spring water, but you're talking about spring water gathered in a pristine environment. And there's not too much pristine environment allowed in the United States these days. What the best water I ever tasted in my life was when I climbed a mountain in Juneau, Alaska. The mountain overlooked, Mount Juneau overlooked the city of Juneau, Alaska. And I climbed that mountain, and I actually have some photographs of me swimming in a ice pool at the top of that mountain. A snow pool, actually, I should say, not an ice pool, a snow pool. The snow went right down into the pool, and I'm sliding down the snow in my underwear into the water. That was cold, but it was so delightfully invigorating. It was incredibly invigorating. And I'll never forget that moment. I was a bold young man and I climbed a mountain, but the water was so pristine and clear that when we climbed the mountain, they said, do not carry your water up the mountain with you, carry an empty plastic bottle. And I found out why they said carry an empty bottle, plastic, to carry an empty bottle with you. And the reason I carried an empty bottle because the water came out of the side of the mountain. It was the most pristine, pure drinking water, and it was fully mineralized. Beyond that, coconut water is excellent. Beyond that, I would say reverse osmosis. Filtered water is very good, especially if it has been oxygenated. But reverse osmosis does remove minerals from the water, so you got to make sure you're supplementing your minerals. That's a very good question. But of all those waters you mentioned, coconut water and spring water are undeniably the best. He also, what are current natural therapies for alopecia? The natural therapies for alopecia would be an autoimmune therapy to just defeat, if you can defeat any and all autoimmune disorders at the same time. Alopecia is an autoimmune disorder that is resulting from chronic inflammation, chronic inflammatory condition. The main cause of this chronic inflammatory disease condition is diet. Diet and nutrition cause constant daily chronic inflammation daily. And if you go through inflammation for so long, it's going to show up somewhere. Autoimmune disorders are where it shows up. So what would be the diet to combat it? It would be all of your anti-inflammatory foods, from your pterostilbene in the blueberries to resveratrol in the dark colored grapes to vitamin C, ascorbic acid to alkaline foods to, I mean, it goes on and on and on. All of the good stuff, chlorophyll, anything green is going to be good for you. Everything green. You're going to include supplementation in that diet. So if I were dealing with alopecia, I would contact me, because alopecia is not real complicated, but it is stubborn and it is persistent and it does make people angry. And it is also, alopecia is also a natural process of aging, you start to see alopecia showing up as your eyebrows start to thin out. My eyebrows are a little thin. That's mild alopecia. The alopecia you're talking about is everything falling apart. And she said, for Africa is in the house, she says, dovetailing on Nguvu's question, are there specific treatments for post-menopausal women? Oh, yes, yes, yes. In fact, I did a program about a week ago specifically focusing on the stubborn of body fat, weight loss for post-menopausal women. So for women, for postmenopausal women, if you're dealing with alopecia or other things like that, it's a little complex for me to talk about just off the top of my head in the program. I would suggest you read the books Living Superfood Solutions and Stem Cell Therapy. There are other books that I've written that are going to be informative on this one, such as 100 Plus Lifespan, very good book. Living Superfood Longevity, another very good book. My book, I haven't talked about it a long time ago, but Furiously Vegan. Furiously Vegan. So it's a good question in Google. And for Africa One, she says, I'm dovetailing on it, and that's a good question. But I would say it's going to require more than me just talking to you for 5 minutes to give you that solution. Do all the things you do that you know are right. Stop doing all the things that you have heard me say are not cool. Don't eat red meat. Don't eat white meat. Don't eat the chicken. Don't eat the pork. Don't eat eggs. Don't consume dairy. Stop all of that. That leads to autoimmune disorders. Terry, she had an autoimmune disorder, sarcoidosis. And after we first got together, she started eating living superfood. Her autoimmune disorder disappeared. After 10 days, it was gone. It reoccurred one time I saw it come back, but then it pretty much had disappeared, and other very beneficial things happened as well. After 10 days, autoimmune disorders are supported by our chronic inflammation. I'm trying to put it as succinctly as possible. Chronic inflammation is the challenge here. Get rid of chronic inflammation, and watch the disorder go away. Get rid of chronic inflammation and watch WATCH these disorders disappear. That's right. Do it. Get rid of these. And with alopecia, start growing your hair back. But for you to grow your hair back, you need to attach stem cell regenerative medicine. You need to regenerate those hair follicles. It's very true. If you look closely at me, and I am 70 years old, but certain of my hair follicles did regenerate. Last time I did that 56-day regenerative therapy, and my hair follicles did regenerate. They came in black again. And I was wonderfully surprised about that. I'm not so much concerned about what my hair color is as I am concerned about what is inside my body. And we are nearing the end of the program. I had more research pulled up for today. Did I get through it all? I think I did. 1 second. And for some odd reason, I had a real hard time starting the program today. Hopefully tomorrow it won't be the same. We're talking about medical nutrition therapy. We did cover that. We're talking about diabetes self-management training versus medical nutrition therapy. They're separate but complementary services. We had talked about how the Medicaid Part B will pay for these diabetic self-management therapy or training and medical nutrition therapy, and they don't want to pay for anything or anybody else. And so I think we've gotten through all of this for today. Yeah, we did. We did a good job. Didn't even have to use my AK. And we did talk about wheat as a perfect poison. The research from Dr. William Davis. I cannot recommend his work, his book, too much. And we have to understand he is contradicted by Urugu. So it is what it is. The article did say Dr. Stephen Basinger noted that wheat is good. So he contradicted Dr. William Davis in the very same excerpt that I found. Personally, I will study both arguments, although I have a strong tendency to believe Dr. William Davis's research to be authentic and superior to Dr. Stephen Basinger on this particular thing. I never heard of Dr. Stephen Basinger before. Maybe I'll just look him up real quick. Who is Dr. Stephen Basinger? Doing a follow-up question. Who is? And I'm going to look it up real quick. Who is Dr. Stephen Basinger? The one they used to criticize Dr. William Davis? Stephen Basinger is a distinguished figure in the field of plant breeding and genetics, particularly known for his work with small grains such as wheat, barley, and triticale. He has served as a primary small grains breeder at the University of Nebraska and is recognized as a world leader in wheat breeding. His research focuses on improving the agronomic performance, winter hardiness, disease resistance, and end-use quality of these crops, as well as developing cutting-edge breeding methods. Dr. Basinger has been instrumental in the development and release of 40 cultivars and 36 germplasm lines or population, with his wheat cultivars being grown on over 60% of the wheat land in Nebraska and extensively in the North Great Plains. His work emphasizes biotic and abiotic stress tolerance, the development of hybrid wheat, and the use of biotechnology, including geogenomic selection. Dr. Basinger has collaborated with partners nationally and internationally to develop new winter wheat, barley, and triticale cultivars and new breeding methods. He has also contributed to agricultural sustainability and profitability, with a particular interest in international agriculture and helping humankind in both developing and developed countries. Additionally, he has been involved in teaching, focusing on plant breeding at both the graduate and undergraduate levels, and has shown keen interest in using web-based technology for educational purposes. Reading that biology from Dr. Stephen Basinger, I have to ask this question. Is Dr. Stephen Basinger connected to or working with Bill Gates? That's the question I'm asking. Is Dr. Stephen Basinger with expertise in plant breeding? There is no direct evidence or information providing in the context that there indicates a collaboration between Dr. P. Stephen Basinger and Bill Gates. Bill Gates, through his foundation, has been involved in various global health and agricultural initiatives, but there is no specific contribution or collaboration with Dr. Stephen Basinger is mentioned in the provided context. Okay, so I'm going to accept that he is not working with Bill Gates, because if he was working Bill Gates, I'd throw up a huge flag of caution to anybody caught up in that. And I'm not even going to go off into the topic of for today of what is Bill Gates doing that I am so concerned, alarmed, and apprehensive about. You know that. We'll do that on another day. Today was a good day. As Ice Cube would say, I didn't even have to use my AK. I want to thank you all for tuning in to LIV Radio, LIVTV, livinginblack.com. You've been tuned into what we hope to call to be known as your favorite. We are your favorite. I hope we are. We are LIV Radio, LIV TV. We are livinginblack.com. Tell your friends to tell their friends that we have our own now. And we should be proud of who we are, what we have, what we do with what we have got. And on that note, I'm going to wrap it up. I'm going to see if I can get out of this gracefully today without just falling out of the program. LIV Radio, LIVTV, livinginblack.com. I thank you for being a part of everything that we're doing here. And there is no graceful extra for today. Something went wrong and I can't figure out what it is. So on that note, I'm going to just play the bumper music, take you out for today. And that's it. That's how we roll. Here on your favorite. We aim to be your favorite. We are LIV Radio, LIV TV. We are livinginblack.com. Peace and prosperity to each and every one of you.